Today we are going to discuss regarding infection chain. What is infection chain? Infection chain is a cyclical process that must be completed to spread any infection from one person to another person. There are 6 links. Every 6 links must be completed to spread any infection from one person to another person. What is infection? There should be any microorganism. It should enter in the body of any person and acts there, try to increase their number. We call it as proliferate, and bodily tissues also react against those processes. Combination of every these processes we call as infection. Any person with such an infection may be present those with signals, specialty signals. We call them as signs and symptoms. We call such a patient as an ill patient. Such an ill patient, as signs they show such infection with fever, diarrhea, vomiting, ill looking, such way. And otherwise, other people are not showing such signal to outside, but they are having such infection in their body, and when and having suitable condition they can spread such infection from one person to another person, from him to another person. We call such person as a carrier. So what is infection chain? There should be any microorganism. It should be bacteria, virus, fungi or parasite with having suitable environmental and other factors. Such a microorganism can increase number of their cells. We call it as proliferation. With proliferation, if the suitable place for proliferation may be animal, human, insect or any surfaces with having necessary facilities, or stand in water may be the reservoir for any microorganism. Such a reservoir having only with such a reservoir any organism cannot make any infection on a person. So it should be exit from that station. We call it as portal of exit. If the infection is in respiratory tract of a human, the exit mode may be cough, sneezing, squeezing, biting, kissing, or even with breath. If the infection is in alimentary or gastrointestinal tract, the infection mode may be with diarrhea, vomiting, such a way. On the other side, such a organism in the reservoir can exit by spoiling water or by body secretions or excretions or with blood, such a way. Infection in a reservoir exit from that side. Only infection cannot be completed. It should be transferred from that side to any suitable host. We call such a vehicle as a mode of transmission. Mode of transmission also can be human, animal, unclean body surface, air, such a way. If there is any host and infection is there, to make an infection in such host, there should be any portal of entry to that body to make an infection on him. We called it as mode of entry. Mode of entry also can be vary with the type of infection. If the infection related with respiratory tract, the mode of entry also may be with breathing, and Infection is related with the alimentary or gastrointestinal tract. It may be mode of entry also may be with uncleaned food or uncleaned water, or spread it with uncleaned hand such a way. And also mode of entry may be blood or in procedures or skin wounds like that. Host means any person willing to having this infection. Host, we have, every person have mechanism for protect from those infections. We call it as host response. In certain situations, any person's host response may be breakdown. Such situations like small children, mothers, pregnant mothers or lactating mothers, or persons with chronic illnesses like diabetic, hypertension or heart diseases, or persons having cancer disease, or they are getting immunosuppressive drugs, or such a conditions, they may cause to dysregulated such host response in their body. In such situation, infection may spread and increase their activity in such a body. Again, that person may be infected person. What are the importances of knowing regarding infection chain? We can break down this infection chain in any link to avoid the spread of infection from one person to another person. By knowing about agent, we can remove agent from the environment by using antibiotic. It must be after a blood culture or culture procedure, then identify the antibiotic agent and the antibiotic. We can use antibiotic. Without knowing about antibiotic or culture, there are another methods for avoid the spread of infection. By this link, we can remove agents before they are getting to be severe. We can remove the agent from the environment or from the person's body. We can use cleaning procedures, disinfectant, sterilization, boiling, such a method to remove the agent from any environment. And also we can isolate any person with any infection, and we can use face mask and face shield like that to avoid having suitable factors for proliferate the agent. So in reservoir we can stop having suitable environment for any microorganism to grow. Then we can stop it being reservoir. We can also use sterilization, cleaning method, environmental cleaning and personal hygiene, and also using face mask and disinfected solutions for cleaning procedures. We can use for breakdown link by this link. And also we can stop mode of exit by using face mask, face shield, and otherwise alimentary tract infection we can stop mode of exit. We can break down by using proper sanitary practices and proper disposal of waste like body excretions and body secretions. And also we can look after wounds, surgical wounds or any wounds with infection carefully, and disposal wound excretions carefully. And we can use universal precautions like putting gloves, masks, goggles or PPE for protect them spreading to another way than another person. And also we can stop breakdown mode of transmission by blocking the mode of transmission mode for the infections. We can also use using personal protective equipment like gloving, mask, and such equipment. And also we can use isolation methods for infection, infectious agent transmitting another way. And also we can use social distancing we can take here, and isolation also we can use to break down this link with here. Then mode of exit, how avoid mode of entry for any person. As said also, uh, block the mode of entry we can use face mask, face shield, and proper hand hygiene and proper personal hygiene and proper environmental hygiene we can use as breakdown to mode of exit. And we can we can regulate or we can maintain integrity of our skin to avoid infection, and we can care after wounds carefully, and also using universal precaution methods in invasive procedures and blood transfusion like procedures. And also in the other link, by regulating host response or increasing the host response, we can break down this link. By this link the infection chain, we can increase host response by increase her or his nutritional state or maintain his or her skin integrity well, and maintain physical and mental state as well, and controlling lifelong diseases very well, like away. And immunization also we can take care, and risk persons with immunosuppressives or risk group we can isolate as a protective isolation from another infectious person to protect them from infection. So likewise we can use the knowledge regarding infection chain to break down the infection chain at any link to avoid infection spreading from one person to another person. So with having this knowledge, we will prevent infections among us and wish you all have a healthier future. Your comments I request. Thank you. Have a awesome future.